Good afternoon. A monster the world has never had, COVID-19, commonly known as coronavirus, which has claimed 37,000 lives and continuing affecting the entire world with confirmed cases above 780,000. These are tragic number, but let us not forget 165 recovered cases. Today, I'm privileged to address you on this pandemic, and my message is, we must fight, unite, ignite, prevent, and defeat this monster with resources at our disposal. We must fight in unity with every person in the society. We must prevent any further spread of this pandemic by igniting and distribution of tools and medical resources and observing all the outlined preventive guidelines. I thank my country, Kenya, and the whole world for their commitment to fight the pandemic, safeguard the economy, attend to national and international trade disruptions while enhancing cooperation between stakeholders. I thank our President, His Excellency Uhuru Muigai Kenyatta, for being on the front line in addressing and directing on the way forward in fight against coronavirus, and especially appointing a special task force on the same. It is my hope that the task force appointed will use all the resources available to obtain more information, experiences, and lessons learned from the most affected nations, not forgetting its epicenter, one sighting in China. I expect several common things to emerge on what has worked, what will work, and what may not work in this fight. The need for early detection and isolation of confirmed cases, and strict follow-up and quarantine to close contacts. There is a great need to optimize healthcare, hygiene, and social distancing in fight over this monster. Nevertheless, there is need to communicate, encourage communities, and build trust in this fight. Our country, Kenya, faces a very big challenge that serves as a threat to our collective ability to save lives. These challenges are not unique to Kenya alone, but the entire world. Our government is making considerable efforts in sourcing individual items of protective gear and other medical items. Much more is needed. Our health workers need to be protected. Efforts to obtain aggressive cases findings needed to urgently and massively increase in capacity for testing and caregiving, as well as research and development for a chance to maintain and obtain a vaccine for coronavirus. I'm happy that our country has recovered cases, and it's my hope that our country will continue contributing to the global efforts in finding a cure. All individuals must identify common symptoms and take actions. And these common symptoms may include fever, tiredness, dry cough, ache and pains, shortness of breath, and any other symptom outlined by the health guidelines. To slow transmission of COVID-19, kindly adhere to the preventive measures, which include 1. Wash your hands regularly with soap and clean running water, or clean them with alcohol-based sanitizers. Cough while covering your mouth or using your elbow while coughing or sneezing, and avoid touching your face. Maintain at least 1 meter distance. Stay at home and leave when necessary or when there is an emergency. Refrain from smoking and other activities that may weaken your lungs. And avoid public gatherings. I'm very grateful to those working in various sectors, especially health and security sectors, in the effort to impact health system and members of the general public who are there for information and digital first. I would like to end by a statement from our Health Cabinet Secretary Mutahi Kagwe that the person next to you may be infected with the virus, so keep the 1 meter away distance. We need to stay calm, united, work together, and curb these menace. God bless the world. God bless Kenya. Thank you.